Very important, but not very common. It's a progressive disease. There's no specific cure for this disease, right? So when the cilia fail to convey the mucus layer, the infection stays there, and you'll have infection-related complicated signs and symptoms. So that is the main pathology. So in the infections, we have bacterial, viral, fungal. So in bacterial, commonly we have encounter with staphylococcus and Haemophilus influenza. These are the usual respiratory bacteria that causes lung infection like pneumonia and other things. And anaerobic bacteria also is not uncommon in elderly people, especially who has got bad oral hygiene and there's some dental caries or something like that. And then most importantly, in our country, tuberculosis. Tuberculosis infection also damages the airways in some patients. That's why diagnosis and treatment of tuberculosis early is very important. Now coming to viral, there are many viral diseases that can cause damage of the airways and cause bronchiectasis, like measles, whooping cough. Measles, though they are viral infection, they're self-limiting infection, they're common in children, but some small percentage of children may develop in future this complication of bronchiectasis. Then we have fungal infection. Fungal infection, again, elderly people, immunocompromised people, diabetic people, organ transplanted people, they're immunosuppressed people, they have fungal infections in the lung. Even the fungal infections also can damage the airways and lead to bronchiectasis. That's why I said bronchiectasis is not a disease. It is because of this secondary effect of some disease. It's not a disease per se. Okay. Then you have some congenital diseases. Congenital diseases where some children are born with the autosomal recessive congenital diseases like immotile cilia syndrome, where they have a defect in the mobility of the movement of the cilia. They move at a very rapid and some hundreds of times per second. Such a rapid movement they have, these cilia. So these children who are born with abnormal ciliary functions, ciliary movements, also will develop bronchiectasis. That is one of the genetic congenital cause of bronchiectasis. Usually we see in pediatric group of patients. So we have immotile cilia syndrome and ciliary dyskinesia syndrome. Different names are there. No, and one more. What is the syndrome? Another syndrome? Do you know? Cartagenous syndrome. What is the triad of Cartagenous syndrome? How do you? Anyone can type. I'll name Mustafa Kagalwala. Can you answer, Mustafa? What is Cartagenous syndrome? What is Cartagenous syndrome? Are you typing, Mustafa?
Can I answer?
I'll go to Ritesh. Ritesh is from Hyderabad. I think he's from Hyderabad. Is he from Hyderabad, Ritesh? Ritesh Raj. What is the triad of Cartagenous syndrome? Okay. Sana Rahman from Nizamabad. Sana Rahman from Nizamabad. Anusha, Rohini Varangal. Anusha from Rohini Varangal. What is the triad of Cartagenous syndrome? Are you getting any answers?
Other people are talking, sir. Anusha has tried situs inversus, bronchiectasis, and oligospermia.
Very good answer. So there's a triad called situs inversus. What is situs inversus? What is situs inversus? Situs inversus inverse. Please, when you're answering, don't Google, don't say that. I want your original answer, not Google answer. Please, don't cheat yourself. Okay, but however, your answer is right. Situs inversus. Okay. Yeah, situs inversus is the transposition of the viscera, transposition of the solid organs in the abdomen. The liver is on the left side, spleen is on the right side, heart is on the right side. That's called situs inversus. What is the reverse of that? Situs solitus. Situs solitus means there is only dextrocardia, but liver and spleen are not displaced. situs inversus, situs solitus. So cartogenesis syndrome is associated with the triad called situs inversus, chronic recurrent sinusitis, and male infertility. So that is azoospermia. Azoospermia. This azoospermia is because of obstructive azoospermia, because the sperm that are produced, they fail to go down into the epididymis, that there's an obstruction because of the ectatic tubes there in the epididymis, vas and other things. So that is the cartogenesis. Cartogenesis syndrome is one of the causes of bronchiectasis. Similarly, we have cystic fibrosis. Cystic fibrosis again is not very common in India. In America, it's in US, it's very common. Cystic fibrosis again is a congenital defective lungs. Cystic fibrosis, their lungs develop fibrotic changes and they have difficulty in breathing. It's a irreversible disease. Again, life expectancy is very short in cystic fibrosis. Those cystic fibrosis patients, because the fibrotic changes, fibrotic bands are increased in number, fibrotic tissue is increased in quantity, and they pull the airways. This is called traction bronchiectasis. When one tube is there, it is being pulled to one side. So the architecture gets distorted, and you get what is known as traction bronchiectasis because of these fibrotic bands that are developing in the patients of cystic fibrosis. So cystic fibrosis is one of the leading causes in America for the bronchiectasis. Again, there are many syndromes, as young syndrome, almost like chronic sinusitis and male infertility. That is about genetic. Then, as I told you, third category, first category is post-infection, second category is congenital, third category is abnormal host defense, that is immunodeficiency states. Like we have some primary diseases which are not really necessary for you, complement deficiency and hypogammaglobulinemia. These are the primary immunodeficiency syndrome. Then secondary immunodeficiency syndromes like acquired immunodeficiency syndrome, we have malignancies. Malignancy itself is an immunodeficiency status. And then chemotherapy, patients who receive chemotherapy, or HIV patients, or post organ transplant patients. These people are secondly immunodeficient. So these are the people who are prone to develop bronchiectasis because they develop recurrent infection. That is the reason. So we have some mechanical diseases where